Good morning, good afternoon, good evening. Welcome to If Data Could Talk. I'm Andy Cotgreave, technical evangelist at Tableau and your host for the show. Today, I've got the honor of talking with Peter Walker from the COVID Tracking Project. If you've been looking at COVID-19 data, particularly around the US, it is likely you have been seeing the data from this volunteer-run project. Every day, they're publishing data on tests, on cases, hospitalizations, and outcomes from right across the US and the territories. And they're visualizing this data, using Tableau, which is great. The reason I'm looking forward to this conversation is that, as we've seen, the COVID-19 data challenge reflect the challenges that you and I face as we try and introduce data and data cultures across our organization. So let's get going. Peter, welcome to the show. Thank you for joining us. Could you give us a little introduction about yourself?
Absolutely. Thanks for having me on, Andy. I'm Peter Walker. I am a data viz co-lead here at the COVID Tracking Project. In my day job, I do growth and marketing for a company called Public Relay. And I came onto the project about in early April after things had kind of really kicked off here in the US. The project was founded back in early March, but it's been a wild ride these past 6 months.
Yeah. So tell us, just I really want to focus us on the whole data challenges you've been facing. But tell us, what is the COVID Tracking Project, and what is it? What outputs is it feeding? Where are people going to see your work?
Sure. So the COVID Tracking Project is, as you mentioned, a volunteer organization that's dedicated to putting out the most comprehensive data that we can on tests, cases, hospitalizations, and deaths in the United States. And it came about in early March with a couple of journalists from The Atlantic who just couldn't find a national database of COVID-19 testing, and started to put together a spreadsheet, which became a database of their own. And that sort of has taken off. People use our outputs. I believe our API is being pinged about 2 million times a day now. So it's into universities, news organizations, research labs, anywhere that really needs COVID-19 data to either build a model or discuss, decision making. Yeah. They use our data.
And I think that story is amazing. It started off as a spreadsheet and it evolved into a hugely used API, right? So that's obviously a data challenge reflecting the year we're living, but it's obviously a story that organizations face. Did you know much about how the early founders kind of recognized the whole explosion of what was actually needed to make a success of this project?
Well, honestly, I think it was sort of an ongoing realization. At the beginning, I think they founded the project around the 7th or 8th of March. And the initial thinking was that the CDC was going to have this national database clean and ready to go by maybe 2 weeks from then. And now here we are 6 months later. The CDC has published their own fully comprehensive data set, but didn't do so until about May 9th or 10th, if I remember correctly. So that's over 100 days since the pandemic began that there really was no national aggregated database for this kind of data. And there are still significant differences between the data that we collect, which is directly from the states themselves, and the data that HHS and CDC has access to. So to be honest, I think this is far more of a challenge and an endeavor than they were initially anticipating.
Yeah, I don't know if you know the answer, but can you outline some of the main differences?
At the beginning, the main differences were in the testing themselves. So there were, I think in the beginning of May, it was something like when the CDC first published their data set, some states were more than 25 or 30% off in terms of the total number of tests, which obviously impacts the positivity rates, which states are using to, for instance, allow people in and out of their state. I mean, in New York, you can't travel to New York if you're coming from a state with a certain level of positivity. So that has real world impacts. And those were significantly different from our data. Over time, they've sort of had some, come together a bit. But I think the biggest difference between us and their data at the moment is with hospitalizations. So, right. It's been in the news a lot about the HHS and what's going on with hospitalizations. And that's something that we've been tracking very closely.
Just for those of us not in the US who might not be, and I'm not, so people who might not be so knowledgeable, what is the HHS and hospitalization issue?
Sure. So HHS is the Department of Health and Human Services. It's a federal agency here in the US. And they sort of took over the collection of hospitalization data from the CDC in July. And
Right.
there was a big uproar about this system. And it turns out that perhaps some of the more conspiracy thinking was not correct, but transferring from a system in the middle of a pandemic, from a legacy system into this brand new one where you have to report a lot more data, is really taxing on these individual hospitals. So it looked like the data was very incomplete for a while, but it was really that hospitals were having trouble even reporting on a daily basis because there were so many new fields that they had to get a hold of. So it's been a real challenge over the past, I would say, almost a month now to get HHS's data to make sense. And it's starting to a little bit, but it's still not, it still has weird gaps and drops that are unexplained. So it's just been a whole sort of fiasco, quite honestly.
So I understood. And I think, I think talking about the aspects of data programs, right? We've got to collect it, clean it, analyze it, and share it, right? Should the US not have had this data set available? Is that, as a big organized, big country with lots of people and health, wouldn't this thing have already existed as a data set, or the health of people?
That's what I would have thought when I came into this, quite honestly. I think some of it is down to the federated nature of the US, though. Every state is collecting slightly different data. And at the beginning of the pandemic, they sort of built up their own tracking and didn't have some national unified way of looking at things. So because some of those decisions were made individual state by state basis, it's kind of caused ripple effects and problems down the line. Yeah. There wasn't a one-page script where it was like, collect these data in this way. Every state did it their own way, and now it's sort of trying to mash those systems together. And obviously, with 56 states and territories, that can be difficult.
Yeah, this is one of these echoes of real life, right? You sit and you think, the US, surely you'd have a unified data system, right? But I think anybody listening to this, if you are in an organization with more than 100 people, I bet you got 3 central ways of collecting data that should all be the same data set, and you cannot bring together, right? So it is one of those, it's like, well, that's how data works in the real world. And, unfortunately, it's, having impact in the pandemic. So tell me about data collection. I think the interesting thing you just said is, like, there was a change in data for HHS. Maybe we wanted more data. It's like, great, we all want more data, but that has a real downside effect on the people running hospitals, right? What's it like collecting the data for your project? How does it get into your system?
Yeah, so it's become a slightly more automated process as we've gone along, but the heart of the project is still manual data collection. So every state publishes new state numbers on their state public health websites every day, generally speaking. And we take down those numbers and make sure that they match up with numbers they put out before. And the interesting part about that is you don't exactly know where those numbers are going to be. Florida publishes 100 pages of PDFs to go along with their data set every day. So have they changed the definition? Have they moved something from page 4 to page 24? You kind of have to dig through these things, and then we have layers of double checking and data integrity behind that. But that's the reason why the project has to be as large as it is, which I think is something like 400 or 500 volunteers now.
Wow.
Because the data is so, it feels complex is maybe not the right word, but it's so sort of dense and difficult to get a hold of and then put into a usable format. So every day our data checkers are pulling in the data and then sort of cross-referencing with the previous day, understanding where the changes have been so that we can put out the stories that are most accurate.
And I've been in the field of business intelligence for almost, I could almost say decades, right? I can almost say, certainly I'm in my second decade, right? And automated data process collection, it's like we've been selling that as a vendor for a long, long time. And you think, can we not automate this? And you're describing PDFs, Excel, CSV, inaccuracies, right? Human entered data. I mean, are there errors in just raw input of numbers, things like that?
Absolutely. I mean, I think that even on the HHS side, we found Florida had about 12,000 people currently hospitalized with COVID-19 in the late part of July. And then for some reason, for 3 days, they had 21,000 people hospitalized. Wow. And that was clearly just a transcription error, but it wasn't, it wasn't communicated as such. And then it went back to 12,000 after those 3 days. So if you had just happened to cross that website for their, that 3 day period, you would have had a far different view of this pandemic than reality. And that's happening at micro levels all over the place.
And possibly jump into one of the questions I had for later, but those kind of errors in numbers then get reported, don't they? Right. This is one of the challenges of using your data or any data. There's the data, there's the proximity to accuracy, and then there's the ease with which you can either deliberately or accidentally misinterpret the numbers. Have you seen some of those downstream problems?
Absolutely. I think it's one of the things that we focus on the most, of trying to put out, whenever we end up visualizing this data, trying to make sure that there is really only one interpretation that comes to mind, and that it isn't open to either misinterpretation deliberately or accidentally. But as you said, sometimes there are number errors in our data set occasionally, and in the HX data set at the beginning quite frequently, that are reported out as facts, and then they may end up influencing policy decisions. They may end up influencing school decisions about reopening. So these have, again, real world consequences. So the data integrity here, I've been working with sort of messy data in my corporate life for a while, but this sort of takes on a whole new level of urgency.
Yeah, it's supremely difficult, isn't it? People want the data. They want data about something that is uncertain anyway. We don't know about these things. Everyone's in an unprecedented situation, and the data isn't very accurate, right? It's a perfect storm for accidental insights, isn't it? I think so. How do you make it available? How can people get access to the data and use it?
So I think the main output that we have is our API that's published every day. But we also put out a whole host of things. We have 3 core data sets: the tests, cases, deaths, the main data that you'd expect from states, as well as our COVID racial data tracker, and then our recently launched long-term care tracker as well. So all of those are available directly from the website for the public to use through the API or downloads in CSVs, however it's easiest for you. And then we visualize parts of that data that we feel confident about on the site and of course on social.
Yeah, so I want to talk a little bit about the visuals and the visualization guide, but it's worth digging into these other data sets, because you came out the racial data. Can you explain a little bit about what that is? And I think we probably know why we need it, but just explain how it came about, what it was in response to.
Right. So it was in response to an absence of this data in general. So it's a collaboration between us and the Boston University Center for Anti-Racist Research. And the idea is that trying to demonstrate through the use of data how COVID-19 is affecting communities of color or different ethnicities against the baseline. So, in the US at least, COVID has sort of exacerbated existing health problems that, disproportionately impacted people of different ethnicities. So, Black people in the US are, I think it's still about 2.5 times more likely to die from COVID than white people. And that, when looking at deaths per 100,000. Mm-hmm. And before we had put out this racial tracker, there was sort of bits and pieces of this information, but I think that one of the main goals of the tracker was to illustrate all the gaps that still existed and to push states to do better in terms of their reporting.
I think it's like one of the epiphanies people go on a data analysis life and career. It's like the gaps are sometimes the most important or interesting things to be exploring. Do you think you've seen the impact on the racial data set? Have states adapted and adopted what they're reporting as a result?
Yeah, we think so, actually. There are far fewer unknowns than there were when we first published the data set in May, but there are still obvious gaps. And of course, there's that tricky data problem with definitions. So some states may report race and ethnicity as combined categories. Some may report them separately. And perhaps the data would, find alignment if you could break out all of those categories and according to the same definition. But, Nebraska and California just treat those things differently. And it's something that at some point you're not going to be able to find any sort of agreement on.
And for regular viewers, on our previous episode of If Data Could Talk, we talked with Sheena and Heather about data equity. So if you didn't watch that, go watch that, because it was a really fascinating interview. And that problem again, it's back to, well, surely US is a big, competent organization, right? If you think about it as an organization, can't we agree on a definition? It's like, no, definitions are really hard, even within organizations. I mean, yeah,
right.
I won't tell you some of our Tableau stories about how we struggle to define data in Tableau, but believe me, we do.
I can imagine.
So,
yeah.
Yeah. And you've had the third data set was social care, and there's been some new insights you've shared, you've been announcing around that. Am I right?
Yeah. So long-term care in the U.S. Obviously, COVID, as everyone knows at this point, disproportionately affects older people. And concentrations in the U.S. of older people in social homes, long-term care facilities, and they have been honestly hit harder than anyone over the last 6 months. So less than 1% of the America's population live in these congregate facilities, but it accounts for at least 43% of the deaths, as far as we know. And the reason why this long-term care took so long to put out is because, one, long-term care facilities are sort of done at both the federal and the state level, and oftentimes those two systems don't talk to each other. And then the other thing that's happening is that some states are reporting long-term care cumulative numbers, as you would expect, just as they do the other numbers. And some states are only reporting when there is an outbreak at a facility. And as soon as that outbreak, however they define an outbreak, ends, their reporting ends. So it's this weird sort of mismatch of all of these categories. And so our team has spent hundreds and hundreds of hours trying to get on the phone with these facilities, understand where the state data is coming from, and really sort of put together a comprehensive list of here's what's going on in these elder care facilities. And obviously, given the rates of cases and deaths, it's a gigantic story. Yeah,
gosh, that's amazing. So I think do you have some visuals you can share with us? Because I think you say you've got some great some of the key data that you're comfortable visualizing on the website. I just wondered if you wanted to take a chance to let us see kind of some of the stuff.
Sure thing. Let me go ahead and share my screen real quickly then. Yeah, this is the sort of chart gallery that we've put together using Tableau on the core metrics that we're tracking. I'll just jump into this overall view here. It's a fairly standard view. You've got bars representing the daily values for tests and cases, number of people currently hospitalized, and daily deaths. And then, of course, you've got the 7-day average line, super important to include, as the deaths, given that they've been collected by 56 different sort of regimes, need to be sort of aggregated, and that 7-day average smooths the trend a lot for you. And this is a great way just to track where we are currently in the pandemic. And of course, you can filter it down to a specific region. The US is a giant place. If you live in the South, as you can see, you might be having a very different experience with this pandemic, depending on the month, as opposed to the Northeast, which hit really hard in the beginning, but seems to really have gotten a hold of things of late. So easy way to just sort of judge where the rest of the country.
Yeah, and I think what's amazing, I mean, the contrast is amazing, isn't it? And I think the contrast pops out because what you've built is really very, very simple. It's just line charts and bar charts, and yet that's a very effective way to communicate the data, isn't it? Did you have to iterate on this quite a lot?
There wasn't too much iteration on this one. A statistic that we want to add to this and will be adding really soon is a positivity rate, so the number of tests that come back positive. Another great indicator. We had it on here. We've since removed it. Actually, good example of us wanting to make sure that anything we put out is 100% accurate. It was using confirmed and probable cases instead of just confirmed tests. It didn't change the numbers that much, but even so, we wanted to remove it until we got things completely ironed out in the API.
Yeah, good. Yeah, it's so hard to get a data set that people mostly almost completely agree on. Well, this kind of stuff looks great, and I know you've built this off the back of a style guide as well. Can you explain a little bit about that, because they're really important, I think.
So yeah, this visualization guide. Actually, we put this out not necessarily for our own graphics, so of course we follow it, but just as a provider of this data, we thought it was incumbent upon us to give some suggestions about how to best graph it, and for the many users who are hitting the API every day. And there are some really basic but crucial things. First and foremost, if you're unsure about something, if there's uncertainty in the data, it needs to be caveated, and that caveat needs to be included with the graph. So if you have to scroll down the page to see a footnote, perhaps you need to do that graph differently. And certainly if you're putting something out over social, it needs to have the correct annotations or caveats, because this data is uncertain and it changes all the time. And of course, you've got things like normalization and color choice. Especially at the beginning of the pandemic, you saw the brightest of reds, obviously, for deaths all the time. And is that the best way to be communicating about these really serious real world impacts? There's no need to raise the anxiety by choosing the most alarmist color possible. So even down to these kind of things, I think it's important to give them consideration.
Yeah, that's a really good point. And again, we talked about that last week with John Schwabish on If Data Could Talk, and how to be sensitive with the way you visualize data as well. I also love that this exists. The reason this exists is because, how many more people became data interested as a result of the pandemic, right? Suddenly this is a data-driven thing, and there's lots of people who need to learn this. So I think providing this part as part of your service is really important. Well, look, we've got links to where people can find out more about the project, how to access the data, and I also contribute to the project. I guess I'm sure you're still looking for volunteers, right?
Absolutely. Please join if you have any sort of interest in this kind of thing. We're always happy to have new volunteers.
Yeah. So we'll move on to what you're reading in a moment, Peter. But for the time being, for the end of this section, thanks very much for giving us an oversight of the COVID tracking project. You're obviously doing a hugely important service for tracking this pandemic in the US. Thank you very much. All right. In our second section, we like to ask our guests the thing that they've been watching, reading, listening to, or otherwise consuming in some way that you should probably be checking out. And Peter's got a good one today, but I'm going to go first. The thing that I've seen in the last 2 weeks, which just gave me great joy, was a blog post from a guy called George Cave, and it's the UX of Lego interface panels. And it's brilliant. He's gone and sourced all the pieces of Lego. By the way, America, it's Lego, not Legos. You can go to lego.com and see that definitively. So I'm saying Lego. But he's taken all the pieces of Lego, the little slopey pieces that have a UX display. I remember these from the Space Lego from when I was a kid. And he's taken all those UX designs of Lego pieces and broken them down into types of design, types of display, and actually then reapplied this to real world how to design an interface. It's brilliant. It's absolutely amazing. It's just fantastic imagination and output. So I don't know. Did you see that, Peter?
I must have missed that one, but
you must have missed that one. Well,
excited to get back into it.
Yeah, I implore you to click the link, which everybody else can find down below here. Really, really smart piece of work, and I learned a bunch from it while smiling about Lego. So that's me. Peter, what have you been looking at?
Well, I can't wait to get in touch with my inner child back on Legoland there. I've actually, something about being cooped up for the last month or so has kind of made me turn back to fiction, sort of as maybe an escapism here. But I recently read Liu's Three-Body Problem, which is a work about, a reimagining of what it would be like if we understood that aliens were out there and that they were perhaps coming to Earth over time. And it's not in any way sort of a Hollywood version of it. It's much more intricate and philosophical. And it was fantastic. I loved how it spoke to both the current moment in terms of our geopolitics, but also, we're all sitting here facing a new crisis that we hadn't imagined, and perhaps I needed a different crisis to take my mind off it for a bit.
Yeah, there's certainly a bunch of crises in this. I read it this year as well, actually. It's a great book. I have a weird relationship with science fiction. I'm a nerd. I like science. I like fiction, and I like movies, and I like reading. But I've never really liked science fiction. Try as I may, and every 5 or 10 years, I ask people, what do I need to read? So someone said, read this one because of the deep physics and philosophy, the way it blends them together. And I did really enjoy it. I still don't think I'm still not converted to sci-fi.
Not converted?
Like, it feels like a failure in my own personality because I should be, right? But I'm
no, you got to listen to yourself there,
Yeah, I like horror. I'm a horror fiction consumer, so that's my niche. I play that one. Anyway, but it is a really good book, and yeah, science and philosophy all in a really cool story. It's amazing scope. All right, well, check it out. If you've read that book, let us know what you thought of it. All right, well, Peter, that concludes our time. I want to thank you for the conversation, Pete. Again, thank you for what you and all your volunteers are doing at the tracking project. It's a huge service to everybody who wants to understand what's happening with the pandemic. And thanks for sharing the three-body problem as a book to recommend as well. So with that, I want to thank you all for watching. Let us know what you thought. Give us a comment. Tell us who else you think we should be interviewing on the show. Wherever you are, have a wonderful day. And we'll see you next time on If Data Could Talk. Take care. Bye.